Okay, so today I want to talk about low back pain in golfers. It's the most common thing that you guys are seeing. After talking to most of you on the podcast, you all mentioned low back pain is top of the list in most common issues that you're dealing with or trying to work around when trying to work on people's swings with them. So, what is one big thing, especially if you talk to TPI guys and other institutions like that when it comes to causes of low back pain? They're all going to mention first that reverse spine angle, right? So as we come back, where we start to tilt, if we take a line from the belt to the head, we'll see it's pointing towards the target as opposed to staying back and actually rotating through the spine. Lots of reasons for that. Now, whether or not you guys want to work on that, I know is now something that's kind of up in the air. Maybe there's different opinions on it. In some cases, they found that that is kind of a characteristic that can actually create more speed and power. But again, leave that up to you guys. If you are seeing it, and if I'm seeing it, and it's associated with low back pain, then all that I want to do is make sure that we're working on the right things, that the golfer has the opportunity to not do that, right? So that if you guys are deciding to coach out of that and use some other mechanisms, that they have the ability to do that. The issue is, beyond just a motor control thing, is that a lot of times it is a mobility issue. So the first place we'll look is that T-spine. So if you're dealing with this and struggling to work with a client or a student who's using reverse spine angle strategy, remember, a lot of times it's probably because they are lacking in T-spine rotation. So if they are unable to get to those positions you're trying to get them into, or they can't quite do it consistently, they're probably fighting something. Think T-spine and think hips. These two spots are also highly associated with just having low back pain in general, missing mobility here and here, right? So first thing, T-spine rotation, if that's an issue, they're not going to be able to continue to rotate through here, and they're going to do something that tries to mimic, like you're getting more rotation or motion, and they're going to start tilting. That can lead directly to low back pain as these facets start to jam up as we come out of that position into that downswing. Beyond that, hips, right? So we need to make sure that they are able to rotate into that hip. Now, what we're talking about here is acetabulum on femoral rotation, internal rotation for this outside leg, external rotation for this lead side leg. So if that's an issue, especially this backside hip, where we can't get this pelvis to rotate on this hip, again, it's a closed chain, so it is not a femur moving on acetabulum, it's actually the acetabulum, the pelvis moving on that femur. So that's something that we're going to assess and we're going to work on, especially in someone exhibiting low back pain, especially someone showing reverse spine angle. If hips are an issue, we can work to open up space in that hip. We can work to open up space and create length in those tissues that are responsible for allowing internal rotation. And then we can increase our motor control awareness and strengthen the muscles that create internal rotation. But we also need to make sure that we are integrating that in a standing position, grounded feet, closed chain, and actually working to get into internal rotation here with pelvis on femur mechanisms, not femur on pelvis. Okay, pelvis on femur. Because in the golf swing, that's what's happening. This is a closed chain. So that femur is stable while the pelvis has to move on top. Well, this opens up another can of worms here because we got to work on separation and stability now. So we need to be able to create the motor control of pulling that pelvis through and rotating onto this leg and using the correct muscles to do that. Externally rotating through these glute muscles here, using groin, adductor, and other muscles to pull ourselves into that hip. I do a lot of work on pulling ourselves into one side and pushing ourselves into that one side. Most people will show that they have an issue getting into one side or the other, shifting from one side or to the other. It's just kind of a common human asymmetry where we favor one side over the other in that way. You'd be surprised, just shifting weight from one side to the other, especially in dynamic movements like the swing, becomes a problem. So beyond working on creating space through here, beyond working on motor control of creating internal external rotation, we also need to integrate that into a standing closed chain position. So hips, T-spine, mobility, and stability, like I had mentioned. We need to be able to rotate this pelvis on a stable trunk, especially when this stops moving. Now we need to be able to rotate this trunk on a stable pelvis. So we might have access to that full rotation if we do some table testing, but if they can't control it and create separation and do one on top of the other, then they can't do it in the golf swing, and you might still find reverse pivot. So we got to make sure that we integrate that as well. The last thing I want to mention when it comes to low back pain, if you're really struggling with someone, to get them out of a reverse spine angle or any other swing characteristic. And by the way, any swing characteristic can really pop up with someone dealing with low back pain. They will do anything to avoid that painful position. Their body will do things they don't realize they're doing. So you might be begging them to do something and they just won't do it. We talk about feel versus real. Again, sometimes it just takes practice for them to feel, this is really that position you're talking about? That's insane. You guys have all experienced that, but there's other times where it's a little bit deeper. In the CNS, we call it a central issue. In this term, this case, we're talking about brain. A central brain issue where they are trying to stay out of painful positions or pain-provoking positions that they've created in their own brain as something that is dangerous, and they will not do what you're asking them to do subconsciously. That brain is going to avoid doing things. It's going to avoid what they think is extreme levels of rotation in vulnerable positions because they think it's going to lead to pain and injury. So that is another component. If we break it down simply, we got hips, T-spine. If you're working on someone with low back pain, we have to make sure that those are checked, and then you're kind of free to create as much changes as you want, except for the last thing, which is central. There's something called a yellow flag questionnaire, which I use with a lot of chronic pain, especially patients, where we need to understand what is the degree of the central problem here. How much of this is coming from the brain? And you will be shocked to see, if you start diving in this a little bit and start practicing it a little bit, how many of your golfers are dealing with central issues in terms of their motor control, their patterns, the things that you're seeing, and maybe why they're avoiding certain patterns. Again, central. So yellow flag questionnaire, I'd be really curious to see if some of you guys started using a yellow flag questionnaire with anyone who has mentioned, yeah, I got a little pain here, there, comes back sometimes, or someone who's really dealing with some pain, especially if there's any neural involvement. And doing a yellow flag questionnaire, I can help you kind of break down the results of that, and then showing them, working on them for a couple weeks, seeing that improvement, and then retesting that yellow flag questionnaire and see if their improvement is also associated with changes on how they fill out that bracket, or if they're not getting changed, to see has that yellow flag questionnaire changed at all. Again, different ways of seeing how much of this is coming from central, and I certainly use it with chronic pain patients as well. How do we fix central issues? It can be complicated. One big thing is we have to prove to the golfer that they are strong, stable, and capable, that they can do these activities, they have access to the ranges they need, they have strength, and they are resilient. They're not going to hurt themselves. So it is through movement and targeted specific movement to prove to them and to the brain that they're safe. It all comes down to safety when it comes to central issues. So consider these things when you are dealing with a golfer giving lessons who has history of low back pain or is dealing currently with low back pain. We know that we want to check off things like hip mobility, thoracic mobility, trunk stability, pelvic stability, and central components. And this can show up as a reverse spine angle or anything else really when it comes to low back pain, early extension, whatever, sliding and swaying, whatever it might be. Anything to, in their brain, maybe to avoid certain positions that they think will cause them pain, or positions that they just don't have access to. One or the other, mostly both. So hopefully this is helpful. It can jog your memory to think of some different issues with patients or clients, in your case, students that are just really struggling to come along, especially maybe some older students that you're working with. So reach out if you have any questions. We can talk more about that yellow flag questionnaire and so maybe some drills and exercises that we could do even on the golf course to warm up some students that are dealing with low back pain that can address hip and T-spine right there on the golf course.